We chose to do our presentation on falls prevention. Research has shown that there is a high incidence of falls in inpatient settings for adults over the age of 65. First, we are going to give you a little bit of background information on this issue. In a study done by Corman, it was determined that the number one cause of unintentional injury and death for seniors in the United States is falls. By the year 2000, falls by patients over the age of 65 years old accounted for 1.8 million emergency department visits annually, 433,000 admissions, and 15,800 deaths. The average cost of hospitalization for the consequences of a fall is $17,500. The total cost for elderly adults who have fallen exceeds $19 billion.
Falls occur in 1 in every 3 adults over the age of 65. Of these, 20 to 30% sustain moderate to severe injuries. Research has shown that a history of falls is a significant risk factor. The likelihood of a patient falling again in the next 6 months was estimated to be 3 times greater if the patient had fallen in the past.
This information is important because with a large number of fall occurrences, especially in the elderly population, it is crucial to address this issue on inpatient settings throughout the United States. Because the rate of falls continues to increase, we developed a PICO question to address this issue. Our PICO question is there a lower incidence of falls in older adults on healthcare facilities that implement falls precautions versus healthcare facilities that do not implement falls precautions?
I don't know how to use this darn thing. Oh, Alfred!
Come on up here, have a seat.
Oh, this is nice.
Come on, honey, hop on up there. You can do it. There's a commode just in case you need to go pee or do your business.
Okay.
And here's a walker just in case you can't get someplace. But all right, I'll be back eventually. Okay. I don't know when, but eventually.
Okay. Sure do have to tinkle. I guess I'll use this commode. Oh, my slippers are too far. Oh, I can do it. Oh! Help me!
Mr. Iglesias? What are you doing down there?
Oh, honey, I fell.
Well, come on,
I'm
get up.
sorry, I'm sorry.
Get up. Good grief. What's going on today?
Oh, I was reaching for the commode.
Oh, my. Well, come on.
Oh, I think that was a bit too high.
My goodness, you're eating weeds, aren't you? Okay, so you need to go here?
Yeah.
All right, well, have a seat.
Okay. Oh, thank you.
What went wrong? The patient was not oriented to the room or the unit. A falls assessment was not completed. The bad nurse did not ask if the patient had ever fallen before. She also did not ask what medication the patient is currently taking. Some medications can cause the patient to be dizzy and fall. The patient was not asked whether her vision has been tested, her level of consciousness was not ever assessed, and much more. The bed was not in the lowest position, and only one bed rail was up. This leaves the patient at risk for falling out of bed. The patient was not assisted into the bed. The bad nurse just put the walker and the bedside commode in the room and did not provide education. She did not encourage the patient to call for help, and she did not provide the patient with a call light. The bad nurse used poor body mechanics during her care. When responding to a fall, you must assess the patient before they are moved to ensure that there was no major injury. And you should get another person to assist in moving the patient. And most of all, a fall's precautions were not implemented. For example, no bed alarm or non-skid footwear was provided.
Alright, Mrs. Iglesias, now that I gave you a tour of our unit, I'm going to go ahead and take you to your room now, okay?
Okay. You like my shoes, honey?
I do.
Got them at a yard sale for about 50 cents.
They look really comfortable.
Thank you.
Alright, why don't you go ahead and have a seat here?
Okay.
Good job. Let me set these down. Alright, you want to lay on back now?
Mm-hmm.
Alright.
Oh, thank you.
You're welcome.
Well, we'll take those pretty slippers
I'll
off.
take that off for you.
Thank you.
Let's get you covered up here. And I have your blanket from home.
Oh, thank you.
You're welcome.
Oh, you're so sweet.
Do you mind if I...
My mother made that. She passed a couple years ago.
Do you mind if I ask you a few questions?
Oh, no, honey, sure.
All right. Can you tell me what your name and date of birth is?
I'm Mrs. Iglesias, and my birthday is June 13th. Oh, 1931, I think. Good Lord, I can't even keep up anymore.
All right. Can you tell me where you are right now?
The hospital.
Do you know which hospital?
I think it's one of those downtown hospitals. I'm not. My daughter took me here.
Okay. Okay. Do you know what day it is? Day of the week?
Oh, it's the middle of the week. I think Wednesday.
Okay. All right. Can you answer a few questions about your past for me?
Oh yeah, sure.
Have you ever fallen before?
Oh, honey, plenty of times.
Okay. Do you have osteoporosis?
Oh, I think that's what they told me I have, something with the osis.
Do you live at home by yourself, or do you have someone there living with you?
Well, I live by myself. Mr. Iglesias, oh, he passed away a long time ago. I've been a widow for about 8 years now.
Okay.
He was a good man, though.
I'm sure he was. Do you use a walker when you're at home, or did we give you that in the ER?
Oh, I've never used one of those things before.
Okay. And have you had your eyes checked this year yet?
Yeah, I do believe I did.
Okay. And what medications are you on right now? Are you on any?
Oh, I think my daughter gave you a list of those medications.
All right.
She always prepare.
All right. Well, it looks like you're at risk for falls, so I'm going to do a few things to take some precautions, okay, just to make sure we keep you safe.
Oh, that sounds
So
good.
I'll be right back. Your bed is already in the lowest position and your bed rails are. All right, Mrs. Iglesias. These are just a few things since you're at risk for falls that we're going to use to keep you safe, okay? First, we're going to put this bracelet on you so that other people who don't know you know that you're at falls risk, so they can help you walk to the bathroom and stuff, okay?
Oh, okay, that's nice.
I can't get it on. Okay. And then we're going to put these socks on. I know you like your slippers, but
I like that color.
yeah, these don't skid on the they have no skid things on the bottom so you don't fall, okay?
Oh, yeah. Oh, I have some of those at home.
We'll go ahead and put these on your feet.
Okay. Oh, I haven't got a pedicure in a long time. No, I do like that color.
Most of the stuff is going to be yellow because that indicates that you're at risk for falls.
I like yellow. Oh, you're so sweet.
All right. We'll get you covered back up here. Now, I don't want you getting up by yourself, okay?
Okay.
So I'm going to give you this call light, and it has a button for you to press for someone to come and help you. So you can go to the bathroom or get up and walk around, and this is it. And you just press this button right here, and we'll come and help you.
Okay.
And then this is called a bed alarm. I'm actually going to put it under you, and it's a weight sensor, so whenever you get up, it'll make a loud noise. So don't be alarmed when it makes the noise.
Oh, okay.
It's just in case you forget to call out, someone will come and help you.
Okay.
So,
What kind of noise does it make?
well, I'll show you in 1 second. Let me sit you up for a second and put this underneath of you.
Okay.
All right. Lay on back down,
Okay.
and I'll hook it up here. Now I'm going to sit you up and let you hear the noise that it's going to make, okay?
Okay.
All right, are you ready?
Yeah. Oh, that's loud.
Yeah, you can lay back down so that goes off.
Oh.
So if it makes that noise, don't be scared. It just means, it's just to remind you to call, okay?
Okay.
And the last thing I'm going to do is put this on your door so that other people that walk by know you're at risk for falls. So if they see you up and walking around, they'll know to come and help you, okay?
Okay.
All right, so if you need anything, just give me a call and I'll come and help you, okay?
Okay.
All right.
Oh, thank you, sweetie. What's your name?
Maddie.
Oh, thank you, Maddie.
You're welcome.
Oh, I have to tinkle. I'm going to call that little nurse. Oh.
Hello, Mrs. Iglesias. Do you need anything?
I was wondering if you could take me to use that commode, please.
I sure can. Let me clear a path for you. All right, don't move. I'm going to turn your bed alarm off so it doesn't go off.
Okay.
Let's ease on up to the edge of the bed. Good. You've already got your socks on. That's great. Do you need some help? Let me move this for you. Do you? Okay, well, we're going to get up a little bit slow then, okay?
Okay.
So what I'm going to do is I just want you to lift, okay? Ready? 1, 2, 3.
Oh, all right. You're strong.
Are you good?
Uh-huh.
Okay. Go ahead and do this for you. Let's just go nice and slow.
Oh, I gotta lift my pennies up. Oh, thank you, honey.
Okay. And I'm going to put your call light by you, okay? Whenever you need me, when you're done, you just call for me, okay?
Oh, okay.
All right.
Thank you.
You're welcome. Knock, knock. Mrs. Iglesias, are you done?
Yeah.
Okay, great. And let me put your call light back over here. Okay. We're going to lift back up again, just like we did. Okay, ready? 1, 2, and 3.
Oh.
Nice and slow. Okay, you want to turn around?
Which?
Okay. Now just ease down very slowly.
Oh.
All right. Let's get you tucked back into bed.
Okay. Thank you, honey.
You're
Oh,
welcome.
my legs sometimes. Oh. Thank you.
Okay, let's cover you back up. All right, now I'm going to plug your bed alarm back in, okay? So don't get up unless you call out, okay?
Okay.
All right. There you go. If you need anything else, you let me know, okay?
Okay, thank you.
You're welcome.
Mrs. Iglesias, you're doing a very nice job walking.
Oh, thank you, honey.
Did physical therapy show you how to use your walker?
Oh, yeah, yes, they did. They came to my room and they showed me.
Well, I have this gait belt on you just in case you were to get a little lightheaded and maybe fall a little bit, I could catch you.
Oh, good. Yeah. I tend to fall sometimes.
That's okay.
This hospital does a real good job of making sure I don't, though.
Well, that's what we're here for.
What was done right? The good assessor oriented the patient to the unit and room. She placed the bed in the lowest position with 2 rails up and helped Mrs. Iglesias to bed. She performed an excellent falls risk assessment by asking about current medications and eye exams. The patient's level of consciousness was assessed by asking about person, place, and time. The good nurse assessed her education level about the walker. She asked about Mrs. Iglesias' home life and, most importantly, about her history of falls and much more. The good nurse placed a bed alarm under Mrs. Iglesias. Falls risk identifiers were applied. The color yellow was used at this facility to identify a patient at risk for falls. Yellow non-skid footwear and bracelet were applied, and a falling star was placed outside the patient's room. The good body mechanics nurse answered the call light promptly, made sure a path was clear, non-skid socks were applied, and good body mechanics were used. She also reminded Mrs. Iglesias to not get up alone. The good walker used a gait belt and assisted Mrs. Iglesias while walking.
Our solution. In order to decrease the high rates of falls occurring in healthcare facilities, strict falls precautions must be implemented. Examples of good precautions were demonstrated in our video, which showed the right way. These precautions include a detailed falls assessment to determine the risk for falls, such as all the questions the good assessor asked. Color-specific non-skid footwear, such as the socks you saw in our video. a bracelet, and an identification outside the door to alert other staff that the patient is at risk for falls. A bed alarm, bed in the lowest position with 2 bed rails up. This is to prevent the patient from falling out of the bed. Using good body mechanics and the incidence of a fall, such as bending at the knees rather than the waist. And last but not least, having a second person to help assist a patient back into bed after a fall. Evidence to support our solution. In the article written by Dean, a quality improvement project titled Fall Safe was put in place to analyze the amount of falls in the hospital among the elderly. The project was launched in 2010. The project consisted of 3 levels. The first level is implemented for all patients. The healthcare provider asks all patients about a history of falls and also implements universal safety precautions, such as call lights being within reach, non-skid footwear, and much more. The second level is implemented for those high-risk patients who have a history of falling. This level consists of more strict precautions being utilized. The patient is also asked about delirium, depression, infection, medications they're on, and much more. The final level is to ensure the proper reporting of falls if they do occur. Many falls go unreported. A positive outcome was reported by the use of the Fall Safe project. The facilities participating in the project reported a 25% decrease in falls. In another article we found, the author introduces an important topic about not only the patient's education level on falls, but also the nurse's education. The author states, an educational intervention has a positive effect on improving the registered nurse's knowledge level of preventing older hospitalized people from falls. All facilities must require nurses to receive education about the measures to prevent falls and the significant outcomes of falls. If nurses understand the consequences of falls, they are more likely to implement the precautions. In conclusion, once again, we want to reiterate that in order to decrease the number of falls among the older adult population in healthcare facilities, standardized falls precautions must be implemented.
Just watch me do the Humpty Hop. Yeah. Do you know what I'm doing the Humpty Hop? Come on. I do the Humpty Hop. I do the Humpty Hop. People say, yo, Humpty, you're really funny looking. That's alright, cause I get things cooking. You stay.
My name is Mrs. Iglesias.
Do you mind if I ask you a few questions?
Oh, no, honey, sure.
All right. Do you have osteoporosis?
Oh, I think that's what they told me I have, something with the osis. I need to get a hold of you in case I might need a tinkle.
Well, that's why we have this call light for you.
Oh, yeah, that's nice.
This should be open. It's the civil rights. It's the 90s.